all to the 10th DD Educational Grand Round. And today's title for presentation is Social Accountability in Medical Education, Honoring a Promise to Society. I would like to introduce our presenters first. Professor Ruxana Wamid Zubairi. She's member executive committee Association of Medical Education Eastern Mediterranean Region, member Aspire assessment panel for the Association of Medical Education in Europe. She is counselor CPSP. She's the director National Residency Program South, and she's the chair curriculum committee at CPSP. I would also like to introduce our second presenter, Dr. Rifat Hussain. She's a consultant nuclear physician at radiology department at JPMC. She has a special interest in medical education and on social accountability. Before starting the presentation, I would also like to introduce our panelists. We have with us Professor Mushtaq Ahmed, and he is an interim dean of the AKU Medical College. He used to be the chair of surgery at AKU and associate dean for medical education in Nairobi and Dar es Salaam. With us, we have Dr. Al Hassan. He is with us online. Dr. Hassan, can you hear me?
Yes, I hear you well.
Assalamu alaikum. I welcome you to the DD Educational Grand Round. Dr. Hassan, he's an assistant professor of medical education and acting director at University of Sharjah. He's the chairperson group on social accountability, Association of Medical Education in Eastern Mediterranean region. He's the member of International Reference Group on social accountability of medical school. I welcome you all for this 10th Educational Grand Round. And now I would like to invite Professor Ruxana Zubairi for the presentation. Dr. Zubairi.
Assalamu alaikum. Bismillahirrahmanirrahim. Thank you for this extended introduction. And thank you for all the people who are here, especially some of the people, all of you that I revere. The talk today is on actually social accountability. And like it or not, it is our promise to society when we become physicians. So both Rifat and I, we have no financial interest. And by the end of this session, what we would like to do is, this is how we're going to plan this. I'm going to talk about the 10 tenets that I call tenets of social accountability according to the global consensus, which I'll present, so that you have a background and understanding of what, when we talk of global social accountability, what does it mean? And I'll try to keep it brief. After that, Dr. Rifat Hussain is going to talk about what are the issues she found at AKU Medical College during her research, which she did as a master's in health professions education student. Just to let you know and to introduce Rifat in a more global perspective, I first met her and I saw her and she was presenting social accountability in Pakistan at the AME conference in Lyon in 2012. And that was before it had ever been a part of the Aspire to Excellence Awards. And in Lyon, in France. Lyon is in France. And after that, when she became an MHP student, then I'll talk about that. So after that, we will have the way forward, and that I would like your participation. We will be inviting our panelists, they will sit here, but I want your participation on the way forward. What do we do now? And then we will ask for some closing remarks from each of the panelists, if I may request, including Al Hassan Abdullah with us online. So in 2010, the global consensus document was signed. In 2012, I met Rifat presenting her thing of social accountability in Pakistan. In 2013, AME, the Association of Medical Education in Europe, announced 3 awards in Aspiring for Excellence in student engagement in the curriculum, student assessment, and social accountability of a medical school. AKU got the first two. Unfortunately, we did not get the third. In 2018, and that is what actually created this furor, I think, in Rifat's mind. She was an MHP student and she was most concerned, why did we not get it? And she then decided to put all her effort into the thesis, the findings of which she will present. I want to say in 2018, this year, we've just recently signed a global consensus on accreditation criteria in social accountability. And I have to introduce to you the International Federation, the International Federation of Medical Student Association. It is an international association founded more than 60 years ago. It is international, 135 organizations across 6 continents. And the student organization has put forward a policy proposal of what social accountability for medical schools should be. Now, the students are concerned, others are concerned. Where are we? So I'll walk you through the tenets, and these are actually anticipating health needs, partnering with stakeholders, looking at adapting to the evolving roles of the health practitioners, and outcome-based education, governance, refining the standards, CQI, accreditation, applying global principles in the local context, and where is society in all of this. So anticipating the society's health needs means just that, guided. I have actually extracted 2 or 3 lines from pages and pages. So guided by the basic values of relevance, equity, and quality, there should be responsible allocation of resources according to needs and for innovation and new programs. Recognize the social determinants of health, but also to direct its education, research, and service accordingly, not just to recognize it for research. The vision and mission should, in all overall as well as for education, service, and research, should be principally inspired by the current and prospective needs. The most important thing over here is to remember not what is currently there, but what will be needed tomorrow. So we have to prepare the workforce and others accordingly. Partnership with health systems. The local community is your main partner. And we together have to improve the health systems and the health status of the population of Pakistan. The stakeholders, this is a very interesting concept. The stakeholders design, implement, and evaluate the education, service, and research component of the medical college. The medical college and the professional organizations, then they advise the authorities and the government and the local authorities on how the health systems should be organized. So it's a very symbiotic relationship, and I think we need to be working towards it in some way. And this is where we impact the policymakers. Innovative models for defined populations, we all know we used to have once upon a time. Health systems must be based on primary health care, and there should be a good balance across all disciplines. The first level must be integrated into the secondary and tertiary care. And all of this has to be part of the 3 main branches of a medical school. Adapting to the evolving rules. Doctors are not the only people who work in health systems. The medical students must reflect, and doctors are not all want to be tertiary care providers. So the medical student body must reflect the social diversity and the disadvantaged from your own country, which we do to some extent. Competencies must be defined with the stakeholders and other healthcare providers to ensure that it covers all of the needs of the health system. It should be across, it's not the medical school, doesn't just mean the undergraduate curriculum, it means undergraduate, postgraduate, CPD. And the variety of specialists, are they appropriate in quality and quantity? And we need to foster graduates across primary healthcare. In addition, are your graduates then regardless of specialties, doesn't matter if you're an internist, you're a surgeon, if you're a nuclear medicine person, they have to be explicitly active in population health, not just in the curative, but in all its component of health promotion, disease prevention, curative, and rehab. The educational spectrum of the curriculum, teaching, learning, assessment, faculty development, and evaluation must be geared to best meet individual and societal needs, which includes, we have in the curriculum, the lifelong learning, problem solving, advocacy, leadership, professionalism, including ethics, teamwork, cultural competence, communication skills, and all of these. The only thing is, we have to join with stakeholders and other healthcare providers so that the workforce is complete, there are no gaps. And the most interesting thing is that early longitudinal exposure to community-based learning is not just dependent on CHS or family medicine, and that education should be periodically updated. Creating a responsive and responsible governance system, leadership is a key actor. We all know to integrate social accountability. Sustainable partnerships with other health professional institutions to ensure an adequate workforce in quality and quantity. And the entire academic and student bodies must be geared towards meeting societal health challenges. You know, and these efforts, they're certified tools. It says these efforts have to be measured by certified tools. And of course, effective balance between all services. The standards for academic excellence must respond to the health challenges, not just of today, but of tomorrow. When I joined AKU, I know in 1988, Dr. Bryant used to talk of the transitional gap. At that time, there was so much of infection, but we knew non-communicable diseases are coming. And now it's practically got reversed, with at least 60%, if not more, slightly more, if people suffering from non-communicable disease and dying of it rather than infection, or at least equal. And we did nothing to prepare the health system. So anyway, and the education, and then not only the education, but the research and service also must be defined towards defined needs. The educational impact should be measured also by what are the career choices and are they in line with societal priority of your graduates? Are they going where most needed? Is the health medical school looking after the health status around them? The accreditation standards must include interprofessional education, where we learn from and with others. And the standards of quality of institutional governance and leadership have to be followed. And it will come again, so I won't mention it, won't clarify this. PQI, periodical internal reviews. But do we measure progress towards social accountability? What progress have we made as a medical school, or have we gone backwards over time? Systematic and periodic transparent use of measurement tools for evaluation and institutional improvement. I know the board is very bothered about institutional improvement, but do we do this in a qualitative and quantitative way? And do we measure that improvement over time? The supportive governance and responsive and responsible leadership must set high standards, which form the basis of accreditation is a powerful leverage, right, for change. And it should be accredited by the regulatory body, for which in our case is PMDC. Unfortunately, PMDC itself does not have any accreditation. accreditation standards for social accountability, but we have people over there in CMDC we can ask to ensure, like Dr. Tariq over here, who can perhaps help get the social accountability as one of the accreditation standards. And the external reviews must contain not just another person from Pakistan, but from the community or health policy people or whatever. It's not or actually in the thing is written and yes, we do this well. Global principles, standards, local context. Applied, adopted, great. International dimensions are useful. And I think we have Abdullah here, who we can ask also. The international organizations in health and higher education, regional or globally, must advocate for the quality assurance. That is, that the social accountability accreditation frameworks, do they meet, they can ensure that do they meet in the PMDC, our country's priorities. And lastly, of course, what is the role of society? This is always a challenge, huge challenge. How do you balance institutional autonomy with what the community wants? But the important stakeholders, which contain the community, the policymakers, health service managers, health professionals, civil society, they have to be part of the external evaluation team. Put them in different places, if you like. And communities around the medical school in this are regularly surveyed. What is the level of social accountability? So I've talked about 10 areas. We have to be anticipating the needs, not just reacting, proactive. We need to partner with stakeholders. We need to ensure that all the evolving roles are there and open for our graduates and they work according outcome-based education set with the governance has to make sure that this is done. Standards, UI, accreditation, global principles, and the role of society. At this point, what I would like to do with this quote, it is for all of us. I would like to invite Dr. Rifat to present her MHP thesis. These are not views from her, these are not views from me, or these are views of the 9 people. 9 people she interviewed, long 9. So it was a qualitative study, which I think I will ask Dr. Rifat to talk about.
Okay, so Assalamu alaikum everybody. So as Anil uploads my presentation, first I would like to thank Dr. Zubairi for her very kind words. You're too kind and I'm deeply humbled. But let me say to the audience that yes, it's been so many years that I have been reading, looking up, researching social accountability, but I am still no expert. I consider myself less than a novice, and I still go back to my teachers for their continuous support, tutelage and counselings for this very complex issue. Okay, so today I will be presenting the thesis that I did for my master's of health professions education. It was a very in-depth and extensive study, and here I will just be going very briefly through the methodology and then some of the research findings. And this research was, as Dr. Zubairi pointed out, initiated when we lost out on the award for social accountability at the Aspire Initiative of 2012. And I have tried to look at the causes that came about that. So the title of the study was The Cauldron of Social Accountability. And yes, I jumped right into this cauldron and tried to find some portion, right, or otherwise, that would lead us forward to perhaps attain not just the Social Accountability Award, but to be a more socially accountable institution. So to understand this research, let me just give you what this cauldron was all about. Actually, the AKU vision and mission clearly states that it is a service to the Muslim Ummah and the developing world, which actually, from where evolves the AKU strategic planning and working concept of service to community. So, which is actually at the heart of the WHO declaration and the Global Consensus on Social Accountability. So it was not just a surprise, but a very big one that AKU Medical College did not win the Social Accountability Award for the Aspire initiative in 2013. So from here, the rationale for the study developed, which was if the medical college is to honor the vision and mission of the university and provide meaningful contributions to society and act as torchbearers, it was imperative to identify and correct the causes of failure. From here was derived the research questions, which were what were the reasons that we were not able to meet the Aspire Excellence criteria, and what were the issues that were faced in the medical student education, researching health and medical problems, and providing health promotion, disease prevention, and medical care. So the research methodology was that it was a qualitative, exploratory, descriptive case study, the case being Dahal Khan Medical College. And as Dr. Zubairi already told you, I did 9 in-depth interviews with the senior leadership and with the group individuals who were a part of the group that were working on the Aspire initiative to try to put some holistic make it more holistic. I also interviewed deans of one private and one public sector medical university. And then, of course, to make things more meaningful, I also did the document analysis of the Aspire documents that were submitted for the awards. So the data analysis was that it was a qualitative content analysis was done. And manifest and latent contents was analyzed. Codes were developed from which led on to development of the subcategories and categories, and ultimately 2 major themes were deducted. One which had 3 sub-themes and one with 1 sub-theme. And then, of course, as I told you, the for triangulation document review was also undertaken. The results finding was that we had 2 themes. One was turning wounds into wisdom, and the other was the rise of the phoenix. Now, the first theme had 3 confounding variables of defeat, dark shadows of political unrest and other phantoms, and this one, the second had only 1. Okay, so now the sub-themes for the first were 4, and I would like to take a minute and show you some of these. For the educational standards, we had design of study and reaching into community. And then this further had codes of curriculum teaching assessment. And I will only be showing you some of the very interesting verbatim here that were spoken and recorded for research. Hyperlinking work करेगा वरना. No. It was here. Let's go slideshow. Okay, thank you. Okay. And then for the aspiring journey, it was, The aspiring journey, there were 3 subcategories. Sins of omission, in which there was a lack of self-belief and a half-hearted attempt. To err is human, the obvious mistakes that we made, and then how should we go forward. For this lack of self-belief, I would like to show you the verbatim for these. It was a lack of belief, self-belief. We did not believe in our own selves. half-hearted attempt really did not make a very significant attempt. And now the errors, the obvious errors that we made, true oversights. We were lost in confusion. We really didn't know what this was all about. And then there was some indifference. Now this code is very interesting, the defeating perverse of the academicians. Here was discussed the role of the senior leadership, the face of the student body, what the students were doing, and a faculty approaches towards social accountability. This had further two attributes of the past and present faculty, which I will show you. But first, let me show you what the students are actually doing. And for these two, please have a look at the attributes of the past faculty who were the pioneers of this institution. The present faculty, it's not that they don't want to do, but they're inundated with responsibility. But the basic, which is the main responsibility that they are overburdened with, is and then one of them was brave enough to say, the hidden curriculum. Okay, so, and now was the non-alignment to the AKU vision and mission, which was very important because this is the overarching university charter. And from here, please see. And now from the other phantoms, one thing is that I would like to show to you is the talk of brain drain. It's a, yes, it's a global perspective, but how are we looking at it? Are we trying to defend it? Interesting. Okay, so the second theme looked at what can be done. And that was what lessons have we learned and how should we go about them? And this had broken wings with three of these subcategories. And let me show you some of the weaknesses and the limitations. What was the weakness? And then what was our limitation? Or what is our limitation? And then, of course, do not lose heart. We are very courageous. Oh, sorry. And when the going will get tough, we will get going. And I suppose that the beginning of this education workshop is a lead into all of this. Okay, so what we found was that when we looked at the submissions, we saw that most of the areas that Dr. Zubairi spoke about were here, and they were dispersed throughout these throughout the research that I did and the verbatims that came out. But yes, one area was weak. We were doing most of them, little or more, but one which was very weak, and this was area 5, which was as Dr. Zubairi spoke to you. We do not have governance, leadership, and sustainable partners. Then, of course, triangulation with the documenters that were submitted for the Aspire initiative were also reviewed. And then most of the findings were corroborative, but some areas of deficiencies were identified. And one was competencies that was related to social accountability, of course. And then opportunities for optional personalized learning by students. And the third was active engagement and partnership with community, lack of any supportive evidence. So this was actually the competencies was not addressed in our structured formal curriculum. And this opportunities for optional personalized learning by the students. This was that the first year electives are, final year electives are more clinical. And in the first 2 years, we are offering selectives to the students, not exactly electives. So the final conclusion in the end was that Aspire Award was indeed a difficult task. This is a conceptual framework that I have conducted, and in it, on the left-hand side of your screen, you will see these are the wounds or the inflictions that we suffered, and because of that we were suffering from, and because of which we actually lost the Social Accountability Awards. And I would like to think that we burned in them, but from the ashes of this burnt fire, I see the phoenix rising. That is us, that is you, that is all of AKU. That phoenix will rise and will again take up social accountability. And with that, to the right of your screen you will see some of the recommendations that we have, that all of you, my participants, my interviewees gave, which can be done to attain social accountability. The limitations of the study, yes, this was a single unit study. And of course, generalizability was is always a question in the qualitative studies. There was no response from the FTGs. Stakeholders were not interviewed. And then, of course, individual skill and biases and my emic and ethic position. So these are the recommendations, and I call upon Dr. Zubairi to take the podium and take you on further.
So if there are any clarifying questions, we can ask them, because now I'm going to, with the permission of Dr. Azam, we can either get the panelists to sit first, and if you'd like to introduce them and invite Amber. And then what I would like to do is to take recommendations from you first. And if you could move here, we'll write them down, or we will write them down on that blackboard as you speak. And then we'll take the final remarks from the panelists. Over to Amber.
I've already introduced the panelists. I would like to invite Professor Mushtaq Ahmed for the expert panel discussion. Dr. Professor Mushtaq, I would like to invite you to come on the stage. Professor Rukhsana Wamil Zubairi.
Yeah. I'll take the recommendations. If it's okay with you, rather than sit as a panelist, I would like to invite recommendations from you. I and Rifat will be here. So, but we can have Dr. Lubna Beg, maybe invite you to be one of the panelists. Okay, just to, thank you, thank you. Thank you. Pearly Gates is correct. Dr. Lubna, just to introduce her very briefly, she is Pro-Vice Chancellor, Jinnah Sindh Medical University. So that is her positional leadership for all those who've done the leadership course. But a real leadership comes in two other areas. One of them is her expertise. She has done masters in health, in public health, then she did FCPS in community health, then she did masters in medical education, then she did PhD in medical education. And the last one is the real leadership, and that is the commitment towards community health and social accountability. Thank you.
And we have Dr. Al Hassan Abdullah. Dr. Hassan, so he's here with us for the expert panel discussion. And the session is open for question and answers and the discussion. Yeah. Dr. Rifat, I would like to invite you to come. Yeah, or you can come here. Yeah.
So So we've seen these are the 10 areas, and we've heard what were some of the comments. What's even more important is what you already know. You know, these are the comments we got from 9 people. But you, as a collective brain, is much more than that. So we've got these comments. Based on that, what do we do now? So I would love to have recommended, and I would especially like to recognize Professor Rashida Ahmed, who's chair of the curriculum committee, who was we actually wrote the absent was written because there was no response from FGD, and I told her it was because Rashida was away. So instead of writing it in her head, she wrote it on the. And we've got Dr. Kulsum here, so we would especially like to welcome you to this. Thank you. So the floor is open. We can take them one by one. We need a proactive health system who not just responds to needs, but actually looks forward. Yes.
Thank you very much for giving me an opportunity to voice one of the main concerns that I had. You see, when we talk of social accountability, and now I'm talking in the bigger role, the college, me as an educator, not as a healthcare provider. But when one of the, I think this college, this institution needs to relook into its conflict of interest policy, because when I joined AKU, the major struggle that I had was that, okay, I'm here, I have some knowledge, I have some expertise, and I want to disseminate that knowledge and expertise to the whole of Pakistan. But the conflict of interest policy did not allow me to participate in courses that were being offered by other institutions. I could only offer a guest lecture as a guest lecturer, but I was not, the conflict of interest policy prevented me from becoming an active participant in improving the quality of the courses or programs that they offered. And that, I think, is part of social accountability.
We can write that. Maybe conflict of interest. So we can look at the conflict of interest and how much role that plays in the Dr. Mushtaq. Yes, you can see it. I think what meant was that when she's employed here, she can not be a faculty member in any equivalent course or a equivalent program. You can do lectures, you can do workshops, you can do what you like, but not be a faculty member in a course which you're supposed to be offering here.
No, no, no. Can I just add on to that? Actually, sometimes what happens is coming in from the public sector, we find expertise outside, and most of them at AKU, and I deal with that quite a few times. So when we request faculty to kind of work with us and direct a course, even though that course, like AKU right now, is not running a Master of Science in Public Health, and even that course kind of as a program is not offered through AKURI or an MPH or whatever. So you have some MS courses in epidemiology, biostatistics, and one in health policy and management. So for other courses, obviously, so we requested a couple of faculty members to come and work with us and help us with teaching the students and be a course director. So they would be running a course, which usually, well, 90% of the time our courses are in the evening. So that was kind of not the working time. But those faculty members had to take permission and they were not allowed. They only could come in as guest lecturers. Some of them kind of, went out of their way to help us, but they were, and like that, of course, is not as much quality as if they would have been the course directors at that point in time. I think that's what I think kind of
Course
that
directors,
relates to what,
yes.
yeah.
So that's the thing, that to take not just a guest lecture, but to direct another equivalent course if you're doing the same here, or even, but that is, so we can look at that. So that's only one aspect that you can have for different courses, but I want to actually address, it's not just a course. I'm looking at what are we doing for the population, for the people, even not that. what are we doing, say, even in our clinical? Are we balancing preventive, promotive, rehab services with our clinical? I know the ECHO project has come now with Said Hamid, but shouldn't these kind of things be a part and parcel of all? The pediatrics department is doing a huge amount of, of preventive promotive as well. But it belongs to all. So those are, and what are the health needs? You know, plus, do we even sit and think what are the health needs of Pakistan, say periodically every 3 months? And what we, what you, what us together we can do. You see, the issue is I invited you special. We invited somebody else as well, not yet. But no, we aren't. But the issue is that when I talk of social accountability, I'm not just talking of social accountability, AKU. This is a sample. If we are like this, others are going to be in a similar boat. So what can we do for the future?
Okay, yeah, great idea. So, that's kind of, you're talking about collaborations for preventive work, collaborations for partnerships. Yeah,
Stronger.
partnerships. But outside AKU, we do collaborate with other institutions, public sector, private sector. But somehow, although that has kind of improved, and I'm not kind of pointing a finger at AKU in any way, but what happens is that when AKU developed, the other institutions were probably not as, they did not have as much qualified faculty, or the faculty that was more aware. So somehow that kind of, belief became stronger and stronger and stronger. And outside institutions started looking at AKU as, that's not Pakistan, that's something else. So, it's not AKU's fault. It's a little bit is, which has improved, which has changed tremendously. Because previously, if you go to a meeting and an AKU faculty would present, they would say, "We at AKU." So, like, that has changed. The "we" in Pakistan. So it has improved, but not amongst all disciplines. Medical education, yes. Community health sciences, yes. And they are going out and meeting. But I think that's something that we all need to look at, and recognize the strength in other people as well, because they have a lot to bring to the table. Okay. So although, of course, because I started off at AKU, whatever, and being here kind of gives me a little more insight into AKU, which was a long time ago. But there are other people who have never been part of AKU or have not been trained at AKU, have strengths in other areas, which needs to be recognized.
Yeah.
So as an institution, you need to kind of recognize those strengths, which is a journal. Now I'm talking like a person from outside, and because you asked the question that what's an AKU that we could do. So that's something that AKU needs to accept and recognize.
All right, we can do that. Then we come to one of the fostering the outcome. We have a lot of that. Yes, we did not ask a community member or have one of them sit in, but there were a number of people who went round and round. One of the most areas that we found lacking, which I would like to discuss, was the responsive and responsible governance. And I'm talking now not just of the medical school, but for the whole of the medical college, or what we found, because it is the one of the key people to get things going and to achieve is the governance. And they are the people who have to allocate the money and the faculty and the resources to ensure all levels of care are equally, not if equally, but equitably dealt with. So we have found the biggest gaps in this area. So what do we do? Yes. Yes.
Issue, and we realized that. And as Rifat did say, that in heart of our hearts, we knew that we will not get this award. First meeting, we knew because we started very well. We allocated 20% of curricular time. I'll talk about undergraduate, although the medical school includes postgraduate, but because I work with GNE, so that's why I'll talk about it. We started very well. And our leadership was an excellent leadership. That leadership took us somewhere. And we were recognized because we were working with the communities, and somehow down the line, we lost that touch. And I'm sorry to say that we did not think anew. We continued doing things which we were doing, losing touch with the society. Secondly, the security issues, where our faculty and students couldn't go to the community. Thirdly, the community fatigue, because we did not have new sites. The one or two areas which we were using, they fatigued. I was talking to Dr. Samin yesterday, and he said, "Now faculty wo kehte nahi hai. We don't want to be interviewed again." So we were not very proactive in identifying new areas. So well, we are working with community health sciences to see how we can induct the students from day one of the medical school, first year, day one. So we are working towards that in February when the new batch comes in, we shall start because we are working on service. But that we know and we knew that is our weakness. Secondly, or thirdly, I think geopolitical situation, the security issue, and the way these people, I mean, nobody, I would love that our graduates take up public health as their career. But what do we pay them? Is it as lucrative as the service industry? And that is why all the things are happening which we are seeing. And it's a sorry state of affairs. It hurts us. It is very painful. I'm sorry, but we have to work towards improving all this.
Thank you. So if there's any special, otherwise we've only got about 5 minutes left. If it's allowable, yes. So we will ask you at the end. Is that all right? Thank you. We'll ask Dr. Abdullah.
Dr. Hassan, would you like
Yes.
to share your views on social accountability based on this presentation?
Okay. First of all, thank you very much again for the invitation. And I'm very happy to participate with you in this nice grand round. I think there are many points that I wrote, but because of the time, I will concentrate on 2 points. The first one that people mentioned about the work in AQU, and I think now if you want to move towards social accountability, you need to think about change management in a different way. Instead of and I think Dr. Rifat has mentioned this, we do consider that if you want to change, you consider what we call what they call the appreciative inquiry model of change, which builds on the good things, builds on the strength, not just thinking about what things that we cannot do. Because I think every medical college and most of the medical college are doing some sort of work with the community. They are considering the community. So if you build on what you are doing right, you can easily be enthusiastic in moving forward. The other thing that comes from the presentation, and I think it's in different colleges, that there is some confusion between the community-based education and the social accountability. So when we just send the students to the community, this does not mean that we are socially accountable, because social accountability means when we anticipate for the social needs, social health needs. So, but it's a step towards social accountability. So if we can build on what we have in our heritage in each college on community-based education, then we can move forward to be socially accountable. And this is very, very crucial. As Professor Zubairi said, do we know our health needs? If you don't know the health needs, we cannot be socially accountable. And now we have started some work, and I hope if we can do it also in Pakistan with any other college. We started doing research in some of the countries about what determines social accountability in that specific country. Now we are doing this in Iraq, in United Arab Emirates, and in Sudan. And I hope if anyone would like to collaborate with us in the group on social accountability to implement this in Pakistan, because this will give you the understanding of your own context. And social accountability is a context related. Even the social accountability terms may differ between Karachi and Islamabad. So we need to do some work to understand our context, to understand our strength, to understand our heritage and build on it. I think for this short time, I can only say this, and I hope we can have more time to discuss what can improve social accountability, not only in Pakistan, but in the whole region. Thank you.
Dr. Hassan Abdullah. Dr. Professor Mushtaq, would you like to comment on social accountability based on the discussion and the presentation?
Well, firstly, I enjoyed the presentation, and I'm very well. You were the basis of the presentation is your failure to get this award, the Aspire Award. It's very good that you're re-examining why this may be the case. I think that's a good way to begin. I just wondered, what is the foundational basis on which social accountability is built? And I think first, should we have a health system as an integrated health system in which we operate? And shouldn't it be the case that such a health system is integrated right from the hospital to the community level, and beyond the community level to, as Dr. Abdullah has said, to address social determinants of health? If we have that platform in place, it's so much easier to then accommodate the students, the faculty, and the curriculum, and the governance and everything around that. Well, others may have more important things to say than I.
Okay, this education grand round is strategically placed 3 months before our course, which is our master level course on issues in health professions education, in which we will be inviting Rashida as well, if the invitation hasn't already gone out. And that, the whole day is going to be on social accountability. And over there, we will be inviting Usman Chachar and Dr. Pichu, who are the Secretary and the Minister of Health for so this is actually just to ensure the awareness. What are we talking about? These are what we're going to be talking about. From here, we'll have to pick up one or two. We cannot deal with all of them on one day. We'll have to pick up the most important or the high priority ones that have been identified. Maybe take the couple that Rashida talked about, take the couple and try and manage them with what Dr. Abdullah has talked about, and what you're going to be invited there, Tariq Rafi is going to be invited there. We'll talk about social accountability outside this. It's a medical school social responsibility, but ultimately we're all working for the health of Pakistan. So, as I said, this is step one, because Dr. Rafat is going to just put the slide for the recommendations and leave it for you to read. D.
So from the yeah, yeah, okay, from the discussions that I had, and we finally brought out the recommendations that were given by the interviewees, and we just classified them into the various groups. So if you can read them, what was said was follow the spirit of AKU in its vision and mission of social accountability. There should be university-wide presentations of social accountability, that it should become known. Then formulation of a task force that should be formed, and then this should be taken up. Understand the social accountability framework, that the 10 tenets that Dr. Zubairi has spoken to you about. Then, of course, motivation to do the same. And then curriculum redesigning with all stakeholders. That And then for the faculty, the clinicians, especially the review of the business model and admission process. And then voice for social accountability in the conferences and seminars, etc. And then the Aspire to Excellence Academy Award to participate in the workshops and the symposia that are offered, and so that social accountability becomes a common word, not just at AQ, at everywhere. Thank you.
But when we talk of social accountability, I don't want you to talk of, think only of two words. We want you to think of those 10 tenets. And if we think of nothing else, it is three main things. Number one, are we anticipating what the community needs, and how much are we involved with them? Number two, we have to be working with the workforce and the policy makers. I think one of the best thing it said was that they participate in your curriculum design. You advise them in the policies, the authority. And I think this other thing, that corroboration of sending up a task force, because we can't do it all. उसके लिए तो आप task force एक बनाई दें, and which is what's going to be our recommendation to the dean and the provost and the dean of School of Nursing, etc. And pro vice chancellor Miss Ross.
So I just have to add a little kind of a vignette from the health department. So the chief secretary visited us about a month back, and he asked me a couple of other people. I said, like you have so many universities, you, as part of your CSR, because people have started talking about corporate social responsibility, you ask each university to take up catchment areas and they'll develop. So they said, okay. Within 4 days, letter came, and in Tharparkar, every university, LUMS, Dow, us, Shaykh Muhtarama Benazir Ladkana, we were given two talukas each. And then they said, start sending mobile camps. Okay, so I went back again, and we had these meetings. And so all the universities, the other universities, like you very rightly pointed out, whatever I said, like I also know what's happening outside. They said just going by mobile camps, and mobile camps are not needed there. They don't need our doctors to go there. They have enough doctors. So we gave this, we developed this whole draft and said, this is how it has to work, particularly for the two talukas that we have been given. It's Nagar Parkar and Diplo. This is how we're going to work. We're going to collect data on social behavioral indicators. And then, so the reason I said that was because I want you to also think that the government, and Aswan Chacha is aware of that, and the chief secretary is aware of that. So that's kind of is happening, and people that discourse has started.
So it is a very appropriate and timely. Right.
Yes, I conclude the session. Thank you, presenter Professor Roxana Farmer-Zubairi and Dr. Rifat Hussain for the wonderful presentation. And thank you, Dr. Professor Mushtaq, Dr. Lubna Habib, and Dr. Oh, sorry, Lubna Habib. Sorry. And and Dr. Hassan Abdullah for your valuable input. Thank you so much, and tea is served outside. Thank you so much.
Thank you very much. Thank you.
very much, Abdullah. That was
Thank you, Dr.
so kind of you to be there. Well,
No,
we have a number
it's a pleasure to be with you, Prof. Dr. Lubna, how are you?
Yeah. And
Where's the camera?
we've
Oh,
got
hi, Abdullah. What's happening?
Lubna, how are you?
Karachi. We
Yeah.
got to go shopping again.
Okay, let us hope we meet soon again, inshallah. Okay, bye.
कोई बात नहीं अब मेरा मियाँ ना शक करे बाकी है